Now, in examination, often the difference is asked regarding the warm agglutinin and cold agglutinin, autoimmune hemolytic anemia. All those I will tell you how to remember, but let us understand that how will you keep these diseases in an evolutionary spectrum. See, cold agglutinin autoimmune hemolytic anemia is occurring when body is exposed to 4 to 30 degrees Celsius. That means that this disease is not going to happen at 37 degrees Celsius if the external environment is as such. So, this proves that this disease is very inefficient. On the other hand, warm agglutinin is efficient disease because they are able to catch hold at body temperature also. So here, if you plot on evolutionary history, which disease came earlier, which disease came late. So here you can see that earlier you can keep cold agglutinin, then you can keep warm agglutinin. Since it is an inefficient disease, people having so it will require very minimal effort to get rid of this disease. See how I can say that it is a very inefficient disease. Firstly, it is caused by organisms that look like M. M has a central role in all this understanding. We have Mycoplasma pneumoniae, and then we now rotate M, then we get E by just extending the middle portion. Now, and lymphoproliferative disease, these are asked. Now, they are in the early evolutionary history, and also with cold agglutinin, M is common. So here M, so IgM, and we have to here avoid cold exposure. Rituximab can be given, but categorically it has been said that there is no role of steroids, splenectomy, or IVIG. So by evolutionary understanding, you can come on to the terms of diseases that cold agglutinin is quite primitive, therefore it is very inefficient. Therefore, just by warming the body, we can get rid of the disease. Whereas warm agglutinin is a very evolved disease because it can occur if the external environment is at 37 degrees Celsius also, that is at body temperature. So it is going to hurt the body the most because it is able to survive at the body temperature. So it will have n number of causes. So don't remember all these things. Just remember what is related with cold agglutinin, and the rest, when in MCQ exam comes, you just have to rule out the options. And then it is efficient, so it has a long-term antibody, IgG antibody. And now in disease pathogenesis, venous thromboembolism, see, when it can have n number of causes, so obviously at some point of time the coagulation factor would be getting involved, and then lymphoproliferative disorders happening. So ultimately SSR is required, that is steroid, splenectomy, and rituximab, warm agglutinin.